The case that I'll be discussing today is Jenny McCarthy. She is a 56-year-old female who has called Tapestry Health Line to make an appointment to be seen for potentially an STI or an STD. She was born in Pittsfield. She's the youngest of two sisters and one brother, and she's the only one who currently resides in Pittsfield. She is diagnosed with depression, PTSD, and mood disorder. She's currently prescribed medication from the Breen Center psychiatrist. Jenny is a survivor of sexual abuse. This was perpetrated on her when she was a young child at the hands of her uncle. Jenny's experience has included additional trauma at a very young age, 9 years old, when her mother found her father in their family home after he had committed suicide. This also was following a disclosure of her sexual abuse to her mother. So it's unclear as to whether Jenny's disclosure complicated her developmental understanding of this great loss, and whether this is there is guilt and blame associated with the timing of the disclosure. Her disclosure was not validated by her mother, who was at the time left as a widow of 4 children. Jenny never received any psychological help as a child, and it wasn't until the age of 32 that she refers to having what is called a nervous breakdown, which she refers to as a nervous breakdown. She was hospitalized and received treatment for her mental instability at the time. She has had no suicide attempts, but since that period in her life, she's not been able to maintain a job nor volunteer work. She's been less social and also has been able to obtain Social Security and disability for her primary income. Jenny lost her mother about 1.5 years ago. She describes having a codependent relationship with her mother and feels guilty that she was not there at her bedside when she passed, but unfortunately her mental illness interfered with her ability to be present. She's currently suffering from grief, and she has described feeling lonely, resulting in her choosing the wrong guys. And she says that the wrong guys usually only want to have sex with her. They don't want a relationship with her. So Jenny's been engaging in some risky sexual behavior with multiple men. She's never been tested for an STI or an STD, but she's complaining of pain in her vaginal area. Jenny does not feel comfortable having a vaginal exam, and therefore she's put off this appointment for quite some time, in fact, several months. Today we'll be meeting with Jenny and talking to her about options, and also just kind of reviewing some of her history, her health history, her emotional history, and to determine what would be best for Jenny today.